Among the highest risk factors to developing heart disease are male sex, age over 35, cigarette smoking, high blood pressure, high levels of certain blood fats, and a family history of cardiovascular disorders. Other researchers have added to this list another risk factor, the compulsive, hard driving, highly anxious personality. The greater the number of severity, the greater the person's overall risk. These threats to the heart can be divided into two main categories, those beyond individual control, such as age, sex, and heredity, and those that can be controlled, avoided, or even eliminated. Among those in the second category are what cardiologists call the triple threat. These are the high blood pressure, cigarette smoking, and high cholesterol levels in the blood. If you smoke a pack of cigarettes a day, your risk of having a heart attack is twice that of a non-smoker. If you smoke, have hypertension, and eat a diet high in fats without any exercise at all, your risk is 5 times greater than normal. Being fit and healthy is the in thing. Actually, it really never goes out of style. That body is the most valuable asset you could have in your lifetime. Thus it is important that you take good care of it. Give it the proper attention it needs. When it comes to ensuring and maintaining the health, the best option is to do cardio training. What is cardio training? Cardio training involves any activity that requires the use of the large muscle groups of the body in a regular and uninterrupted manner. It elevates the heart rate between 60 to 85% of the fastest heart rate you could get. Some of the usual cardio training activities are walking, jogging, running, aerobics, cycling, taebo, swimming and rowing. Cardio training is considered an aerobic exercise as one is required to move from one exercise to another. The healthy heart. If these risk factors endanger the heart's health, what enhances its well-being and improves its odds of working long and well? Obviously, quitting cigarettes and eating a low-fat diet will help. The next best thing you can do for your heart's sake is to give it what it needs, regular exercise or a complete cardio interval training. The heart is a muscle, or, more accurately, a group or package of muscles, similar in many ways to the muscles of the arms and legs. And just as exercise strengthens and improves limb muscles, it enhances the health of the heart muscles as well. Since World War II, several large-scale statistical studies have evaluated the relationship between physical activity and cardiovascular disease. One well-known survey compared 31,000 drivers and conductors of some bus companies. The more sedentary drivers had a significantly higher rate of heart disease than the conductors, who walked around the buses and climbed stairs to the upper level. The why and how behind these statistics were best explained by classic experiments with dogs whose coronary arteries were surgically narrowed to resemble those of humans with arteriosclerosis. Dogs who were exercised had much better blood flow than those kept inactive. The exercise seemed to stimulate the development of new connections between the impaired and the nearly normal blood vessels, so exercised dogs had a better blood supply to all the muscle tissue of the heart. The human heart reacts in the same way to provide blood to the portion that was damaged by the heart attack. To enable the damaged heart muscle to heal, the heart relies on new small blood vessels for what is called collateral circulation. These new branches on the arterial tress can develop long before a heart attack, and can prevent a heart attack if the new network takes on enough of the function of the narrowed vessels. With all these facts, it is now boiled down to a single question: what should be done in order to prevent such dilemmas? Some studies showed that moderate exercise several times a week is more effective in building up these auxiliary pathways than extremely vigorous exercise done twice often. The general rule is that exercise helps reduce the risk of harm to the heart. Some researches further attested the link between exercise and healthy heart based from the findings that the non-exercisers had a 49% greater risk of heart attack than the other people included in the study. The study attributed a third of that risk to sedentary lifestyle alone. Hence, with employing the cardio interval training, you can absolutely expect positive results not only on areas that concerns your cardiovascular system but on the overall status of your health as well. This particular activity that is definitely good for the heart is a cycle of repeated segments that is of intense nature. In this process, there is an interchange periods of recuperation. It can both be comprehensive activity and moderate motion. Consequently, the benefits of merely engaging into this kind of activity can bring you more results than you have ever expected. These are: Number 1. The threats of heart attack are lessened, if not eliminated. Number 2. Enhanced heart task. Number 3. Increase metabolism, increase the chance of burning calories, therefore, assist you in losing weight. Number 4. Improves lung capacity. Number 5. Helps lessen or eliminate the cases of stress. Indeed, cardio interval training is the modern way of creating a healthy, happy heart and body. Number 6. Gives energy to the body. You can expect more energy and higher endurance after some time of regular cardio training. Number 7. Prevents diseases. One could prevent heart diseases with regular cardio training. It is also helpful in preventing other variety of diseases like diabetes, obesity and even high cholesterol. The cardiovascular training strengthens the heart and the lungs. The low to moderated type of cardio exercises are required for people seeking to prevent diseases. Examples of these are walking, brisk walking or jogging. Number 8. Control your weight. With cardio training, you are able to burn more calories. This will help one who needs to lose weight. While those who already achieved their ideal body mass, the training will make it easier to control the weight. Cardio training helps burn calories. However, this generally depends on your current weight and the kind of cardio training you are undergoing. Better consult this matter with your physician or trainer to know the proper type of training for your needs. Number 9. Lose body fats. Some people do not have problem with their weights. However, there may be some excess fats that keep bothering. Cardio training will help in getting rid of those. The activities involve the movements of large muscle groups. Regularly doing the training will make you leaner. Number 10. Get rid of boredom. Cardio training is fun. It pumps up your system. You will definitely feel more energized and on the go. Recommendations to better enjoy the benefits of cardio training. Cardio training is essential when you need to make health improvements. For starters, it is best to do the 30 to 45 minutes of exercises 3 to 5 days a week. If you are aiming for weight loss, the training must be done 5 days a week. The more frequent you do it, the more likely it is that you will lose weight. However, avoid exhausting yourself too much in exercise. Avoid going beyond 45 minutes. Remember, it has to be done in a regular basis. Start now. Walk or ride the bike around the neighborhood now. Follow that aerobics video you purchased. Set a goal and follow that goal. At the same time, modify your diet too. Eat healthy food. As you increase in the fitness level, the intensity of the training must also increase. This is to have an area of variation and there should always be room for improvement. Implement this by intensifying some parts of the training. If you are into jogging or running, increase speed every 5 minutes for at least a minute or two. It is important that you challenge yourself so as not to be stuck in a stump. Avoid doing the cardio exercises before bedtime. You will have a difficult time sleeping if you do so, as the energy level of the body will stay high for some time. If you are undergoing weight training too, do the cardio exercises right after, not before. It is best to take a snack 30 minutes before doing the cardio exercises. Do not start with training in an empty stomach. This will not help in achieving the proper momentum when you train. At the same time, avoid indulging in large meals too before exercise. Just give your body the proper supply it will need to sustain exhausting movements. It is good to do the cardio exercises outdoors. This way you can easily interact with nature and breathe fresh air. You can also simply enjoy going around the neighborhood as you get your system healthier by the minute. It is possible to make some friends among the people who also do their exercises. Be consistent and stick with the training once you have started it. This is the only way that cardio training will benefit your body and your health in the long run. Do you want to know more about health and wellness? Would you like to know how to live a healthy and natural lifestyle? You have reached the right place, the Natural Healthy Lifestyle channel. We really would love you subscribe and activate the bell. It would be very appreciated. And remember, we love you. So we will help you to have a natural and healthy lifestyle. Take care of your health and enjoy life.